Have you ever felt your hands are colder than usual right after your morning coffee? Or that slight tingling in your fingers that disappears after a few minutes, and that's why you've never paid any attention to it? Stick with me, because what I'm about to tell you could change the way you see that cup you drink every day. I'm Dr. Ethan Cole, a cardiologist, and for 20 years I've been sitting across from patients who, without realizing it, are complicating their circulation with a habit they consider healthy, just because they didn't add sugar. Here in my office, at every checkup, I repeat the same phrase to my patients. It's not what you add to your coffee, it's what the coffee does to your arteries. And this isn't just my opinion. A study published in the journal Hypertension from the American Heart Association found that after just 1 cup of caffeinated coffee, arterial stiffness increased measurably in a mere 90 minutes. It wasn't a hypothesis. It was blood pressure, and pulse wave measurements taken in real time. Today we're going to count down 5 ways that unsweetened coffee, the kind many of you drink thinking you're taking care of your body, can be silently affecting your blood circulation. And I'll warn you, number 1 is the one that worries me most as a cardiologist, so don't leave before we get there. Before we continue, if you feel this could help you or someone you care about, like and subscribe to this channel right now and share it with that person who drinks black coffee every day, thinking it's the safest option. Your dad, your mom, your partner, someone you care about. Let's start with number 5, vasoconstriction of small blood vessels. This means, simply put, that the thinnest blood vessels in your body temporarily narrow. Think of a garden hose. If you squeeze the nozzle, the water still comes out, but with more pressure and less volume per second. That's exactly what caffeine does to your smaller blood vessels. A 2022 study published in the journal International Ophthalmology found that after consuming caffeine, the blood vessels in the retina, those tiny vessels at the back of the eye, measurably narrowed. In some cases, they were 40% narrower. No medication, no surgery, just a cup of coffee. And if this happens in the eyes, imagine what happens in the fingers and toes, areas where circulation is already more delicate, especially after age 50. It happened to Rosa, a 58-year-old retired teacher who came to my office complaining that her hands went numb while she knitted in the afternoons, right after her 4 o'clock coffee. We adjusted her schedule, didn't eliminate the coffee, and the tingling disappeared almost completely within 2 weeks. But here's the part that almost no one tells you. This doesn't stop at just the small vessels. Let's move on to number 4. Number 4 is the increase in arterial stiffness. Your arteries, when healthy, expand and contract with each heartbeat, like a rubber band. Researchers at Trinity College, Dublin, published a study in 2001 in the same journal, Hypertension, that I mentioned earlier, where they measured this directly, just 90 minutes after drinking caffeinated coffee, the pulse wave velocity. The way we measure how stiff an artery is, consistently increased in the participants. With decaffeinated coffee, nothing happened. The difference was the caffeine, not the coffee itself. And here's what I want you to understand. A stiffer artery doesn't flow blood the same way as a flexible artery. It's like comparing a new hose to an old, sun-hardened one. That's the biological aspect. It's not bad luck. It happened to Ernesto, a 62-year-old retired accountant who drank 3 cups of black coffee every morning before his walks. He noticed his legs felt heavy halfway through his walks. We reduced it to 1 cup after hydrating well beforehand, and the feeling of heaviness disappeared. Let me pause here for a second, because this next point connects directly to what I just explained. Number 3, blood pressure spikes. A study published in the American Journal of Cardiology in 2006 measured the direct effect of caffeine on vascular function in humans. The result, systolic pressure rose on average 6 points and diastolic pressure almost 3 points within minutes of ingestion. The same researchers noted that this suggests a clear vasoconstrictor effect of caffeine. 6 points doesn't sound like much, does it? But if your blood pressure is already a little elevated and you add work stress, lack of sleep, or simply drinking coffee on an empty stomach, those 6 points can become a spike that your heart really feels. Marta, a housewife, a 55-year-old woman, told me that her blood pressure spiked every morning during her home monitoring, always after her coffee, never before. I told her something simple. Drink it after breakfast, never before, and with a glass of water. Her readings stabilized in less than a month. Have you noticed that your blood pressure seems higher right before your doctor's appointments after having coffee in the waiting room? It's not a coincidence. This happens every day, all over the world, and very few doctors explain it to you calmly. Let's move on to number 2, reduced blood flow to the hands and feet. Some researchers studying skin microcirculation have found something curious. Caffeine can measurably reduce blood flow to the fingers, even as overall blood pressure rises. In other words, the body redirects blood to the central organs and away from the extremities. Cold hands, cold feet, nails that take longer to regain their color after being pressed. This is why many of my patients over 60 tell me, "Doctor, my hands feel freezing cold all day, and I drink a lot of coffee." Alberto, a 67-year-old retired taxi driver, described his hands as 2 blocks of ice during the winter, always with his thermos of coffee beside him in the car. "It's not ice anymore, doctor. It's my own coffee," he told me, laughing, when he understood the connection. Before we get to number 1, I want to ask you something quick. If you identify with any of these symptoms, write your age in the comments right now. It helps me tremendously to understand who I'm really talking to, and you'll see that you're not the only one with this concern. And now, number 1, the most important. The one that keeps me up at night as a cardiologist. It's the cumulative effect in people who already have high blood pressure. A systematic review of several controlled studies uncovered something every patient over 50 needs to hear. In people with hypertension, a single dose of caffeine, the equivalent of a strong cup of coffee, can raise systolic blood pressure by more than 8 points, and that effect can last for 3 hours or more. 3 hours, not minutes. That's 3 hours of your artery working under more pressure than it should. And if you have your second or third cup within those 3 hours, as most of us do, the effect doesn't disappear. It builds up. Here's the non-negotiable. If you already have diagnosed hypertension, talking to your doctor about your caffeine intake isn't optional. It's essential. I'm not saying you should give up coffee forever. I'm saying that your body, after 50, no longer processes this effect the same way it did when you were 30. Let's recap quickly, because I want this to sink in. Number 5, your small blood vessels constrict. Number 4, your arteries become stiffer. Number 3, your blood pressure rises within minutes. Number 2, blood is drawn from your hands and feet. And number 1, if you already have high blood pressure, that effect accumulates and can last for hours. 5 steps. 1 single drink. A pattern that science has measured time and time again. I want you to take something away before you leave this video. Your body isn't broken, and coffee isn't your enemy. Knowledge is power, and small, consistent decisions. Drinking coffee after a meal, hydrating beforehand, knowing your own blood pressure, are what truly make a difference over the years. If this video opened your eyes, give it a like, subscribe to this channel so we can continue taking care of your heart together each week, and share it with someone who needs to hear this today. Here in my office, and here on this channel, my commitment is the same, to care for you as I would care for my own family. See you in the next video. Remember, it's not the cup of coffee that determines your circulation, it's you, with what you do around it.